Hello, my name is Temitope Shembanjo. In this video, I'm going to be demonstrating sterile gloves and Foley catheter insertion. I have been able to verify the PCP order with the patient care plan, and I've been able to affirm that the information inside documented is correct and rightly stated. And I've been able to gather the supplies and equipment I'm going to be using. I have here a pack of sterile gloves and a pack of Foley catheterization tray. Checking for integrity. The Foley catheterization tray is going to expire by March 2022. There is no rip, no tear of any form. It's intact and it's good to be used. And I have my sterile gloves, which is going to expire by August 2022. There is no rip, no tear of any form. The two equipment are good, in good shape. So I'm going to be going to my patient's room and I'll perform hand hygiene. I'll be having a new glove on. Hello, good morning here. My name is Temitope Shembanjo. I am a student nurse. I'm going to provide privacy. May I know your first and last name? Jackie Smith. Thank you, Miss Jackie. Can you please verify your date of birth? 03772. Good. Miss Jackie, are you allergic to latex? Betadine? No. Good. Miss Jackie, today I've come to insert your Foley catheter. Is that okay by you? I promise you I'm not going to take much of your time. Please, if you have any issue of concern because of insertion, please do let me know. But before we do that, I'm going to do something. I'm going to place my patient in a dorsal recumbent position, and I'll be putting under her a waterproof pad, and I'll have a towel to clean the perineal area. I'm going to cover her with the gown. I only have a perineal area open, which is the area I'm going to work with. So I'm going to be taking up the waterproof pad. I haven't done that. I'm going to take off my hand glove and perform hand hygiene. I already have her legs open in order for me to have enough working area. So I've been able to adjust the bed also to a working and a comfortable height. Having taken off the hand glove, I'm going to perform hand hygiene again because I'm ready to go to the sterilization stage. Now at the sterilization stage, for the purpose of this video, I'm going to be pretending this surface is within my hips and my shoulder because I don't want to break sterility rules. I've been able to wipe and clean the surface, and the first thing I'll be doing now is to open my catheter tray. Now that I've opened, I'm going to keep this as my crack bag, and I'm going to be setting this at the feet of my patient so that I won't break sterility rules right there. Then I'm going to take off this because I do not need it. This will go into the trash down here. Then I'm going to carefully open this. So I've been able to open this, but I'm not going to touch anything inside because my hands are not sterile yet. So I'm going to leave this. Now I want to put on my sterile gloves. I'm going to have the gloves open. So I'm going to discard this because I don't need it. Then I have this open. My right hand is my dominant hand, while my left hand is my non-dominant hand. To fix my dominant hand, I'm going to use the tip of my non-dominant hand to hold the glove at the tip, and I'll be fixing it. This way, and I'll pull this above my wrist this way. When the other hand is thorough, I can pull it further, but this way I've been able to do this. Because this hand is thorough, I want to fix my non-dominant hand, so I can use this to pick this. Same way I fix that. Because this hand is thorough, I'm just going to use this to pull this past my ribs, and this one, since it's now sterile, and I'll pull it past my wrist. So my two hands are now sterile. Then I'm going to take this off by discarding it this way. Now that my hands are sterile, now in the sterile section, I have here the waterproof side, the plastic side, and the paper side. This is going to be the part that goes under my patient. So I'm going to have this go under my patient because I don't want to break sterility rules. So I've been able to fix this. Now that I've been able to do that, I will take off all that I don't need from here. I do not need this. I'm going to take it off. It goes into the trash. I do not need this. It goes into the trash. I do not need this. An extra glove. Here is, I do not need this. And I'm going to be bringing out this tray. I'll bring out this. I have here my syringe of 10 ml sterile water. Then I have here faucet. I have cotton balls, and here is my iodine. So I'm going to open the iodine and I'm going to pour it on the cotton balls. So the remaining one I don't need, I'm going to put it in trash. Then here I have my lubricant, and I'm going to open the lubricant and put a little in the trash bin here. Then I'm going to put that one. I do not need it here in case I need to label anything. I'm going to put this. I do not need this because I'm not taking any sample. So I've been able to do that. My faucet in the tray right here. So the next thing I'll do is I'm going to take off the plastic wrap on my take it to put it in trash. So I'm going to have this cold. Carefully curl this. And I'm going to touch the tip, which I'm going to insert with the lubricant. I've been able to do that, and I'll set back into the box. Then I'm going to fix the syringe to the injection port. I'll take off the cover. I have to fix this. So I'll have this here. So the next thing I'll do is I'm going to go ahead and start cleaning my patient. So I'm going to move this a little bit. I'll stay within 1 inch of the sterilization section. So I'm going to have my 2 hands are still clean now. Now going to my patient, because she's a female, my right hand is going to be my clean hand, which is my dominant hand, while my left hand is my non-dominant hand. I'm going to use the left hand to open the labia, and I'll have it on until I completely fix the catheter. So I'm going to start by putting this hand on the labia. So once this hand is on the labia, it's now a dirty hand. So I'm going to have this. Then I'll have to start cleaning my patient. I'll start cleaning the cotton balls one after the other with the faucet. I'll start from here, up, out, and this goes into the trash. The second one, up, out, to the trash. The third one on the labia, up, out, to the trash. Up, out, to the trash. And this one, up, the last one, out, to the trash. So I've been able to clean my patient. Now with my clean hand, I'm going to go ahead and pick my catheter tip. I'm going to be inserting the tip. So I'm going to open the labia and I'll start the insertion. My hand still on the labia, I will not release it. Now that I've been able to insert the catheter like 2 to 3 inches until I see urine. So even after I see urine, I'll still insert like 1 more inch. And I can see it's firmly and rightly fixed now. So now after insertion, my sterilization process is complete. I can now release the labia and use this hand. I'll fill with the right hand, is intact. Then I'm going to inflate the balloon. So I'm going to inflate the balloon. with the complete 10 ml. I've been able to inflate the balloon with the complete 10 ml. So, and the next thing I'll do is I'm going to secure the tube to the leg, and I'll have my bag, the tubing bag, and beside the bed. I'm going to secure the tube to the bed with a non-allergic tape. Now that I've been able to secure that, so I can now take off my hand glove. I've been able to fix the tubing bag to a non-moving part of the bed. So I can now take off my hand glove. I can take off my hand glove. So I'll perform hand hygiene, and I'll now want to clean the working area. I will adjust the bed of the patient, and I'll clean the working area. All the things I do not need, I'm going to take it off. So I've been able to clean the working area. Now, in order for me to remove the catheter, I'm going to verify the provider's order in order to remove again. So I've been able to identify my patient with the two forms of ID, and I'll provide privacy again. And this time around, I'm going to place my patient in the supine position. So I'm going to perform hand hygiene, and I'm going to be putting on the new glove. So I'll have under my patient a waterproof pad. I'm going to put a waterproof pad under my patient. Then I'm going to remove the taping at the feet. So I'll be able to remove the tape. Now I'll now deflate the catheter by having my 10 ml syringe. So I'm now going to deflate it. The 10 ml, the complete 10 ml that sterile water that I used to inflate the balloon, I now want to remove it. So I'm going to fix it. Without stress, it's coming back by itself. So I'm going to deflate the catheter. So I've been able to dispense the 10 ml that I put in. So I'm going to put that back, put that in the trash. Then I'm going to ask my patient to please take a deep breath, and gently I want to remove the catheter. So please take a deep breath. Now, and I'm going to put it in the glove. I'll check for any dirtiness. To avoid dirtiness, I'm going to have it done this way. And I'll be putting this in the trash. So I'll be able to take off my hand glove. So I'm going to clean the perineal area. I'm going to perform hand hygiene, and I'll clean the perineal area, and I'll lower the patient's bed. I'll give her a call light in case she needs me, and I'll tell her if she have any issue of concern, she should be free to call me. I'll come, then I'll adjust her bed and make her comfortable after cleaning the working station.